the fields of the Lord, our work is rest. He is moving in our hands and feet to bless. In the fields of the Lord, in the fields of the Lord, in the fields of the Lord, our work is rest. In the vineyards of the Lord, our work is light. He is tending every leaf and every vine. In the vineyards of the Lord, in the vineyards of the Lord, in the vineyards of the Lord, our work is light. At the harvest of the Lord, the fields are white. He will wipe away the tears from every eye. At the harvest of the Lord, at the harvest of the Lord, at the harvest of the Lord, the fields are white.
Hey, good morning and welcome to another episode of Catholics at Home podcast. I am Megan. How are you doing? How's your Saturday coming along? Have you had breakfast yet? If you haven't, what's on the menu? Okay. While you grab your cup of coffee or tea and join us for today's episode. Well, today we take a look at a very important topic. Over the past year and a half, we've had to deal with a pandemic that has altered the way we do things, have altered our routines, our lifestyle, and our livelihood as well. And because of that, it has left its effects on our mental health as well. Now, some mental health is something we don't normally talk about, especially being Asians. But today we want to jump into that and we want to see how the pandemic has affected our mental health. And we want you to understand and to know that it's okay if you're struggling, if you're feeling not okay in this time, especially. Yeah. So before we dive right into the topic this morning, once again, welcome to the show. You are more than welcome to like, share, and comment in the comment section below. Don't forget, if you have a question, you can drop it in the comment section and we'll get right to that during the show. But of course, before we bring on our guest this morning, it's time for me to bring on my co-host, the one and only Catholics at Home's resident priest and advisor, Father Clarence Devadas.
Hi, Meg. Good morning.
Father. How
Morning
are you
to
today?
you. I'm good, Meg. I'm good. As you know, we're all in a lockdown, so making the best out of the situation that you're in. So good morning to everyone, to all our listeners, wherever you're tuning in from. Welcome back to Catholics at Home. And how are you, Meg?
I'm good, lah, Father, like you, lah, surviving. I mean, that's the best we can do. We stay home, we survive, we do whatever we can. So, yeah, that's basically it,
So,
lah.
so true, so true. I think I think we talked about it last week also. I mean, resilience. We try our best
Yep.
to, yeah. I think it's a very important topic that we are talking about this morning. Mental health. I would think, Meg, just reading and just talking to people, we are all impacted by this.
Yep.
Emotionally, psychologically. There's no one who can say that they are not impacted by it. Maybe in varying degrees, I suppose. Children. We have talked about children, the inability for social interaction,
Yeah.
people not able to go out of homes, cooped up. So I think we all are somehow impacted. Maybe some of us are able to cope better. Maybe others are not able to cope. They cope in different ways. So
Correct.
I think it's a very, very important topic. And to all our listeners, we shouldn't, I think, negate that fact that we are impacted. We are
Absolutely.
affected. We are affected by it.
I think, Father, most of the time we kind of brush it off as it's not a big deal, because mental health, good mental health, has only been like, coming up recently. And, growing up in the 80s and 90s, it was not something common. We never spoke about it, So people didn't know how to describe how they were feeling, and they were struggling, and it just became normal, when we could reach out for help. So I think that's one thing we want to take a look at today. And also we want to find out how that landscape has changed as well, because as you mentioned, Father, the pandemic has left its effects on each and every one of us, whether
Yeah.
we realize it or not. So today we have two guests, and both are very, very prominent in what they do. They're very kind, they're very amazing at what they do. All I can say is that they're amazing. Okay, so I think it's time for us to bring on our guests. What do you say, Father?
Yes, Meg. I mean, it's a nice way to talk to them. And I
Yeah.
think to open new doors for people, I just wanted to add, I grew up, probably you also grew up at a time when if somebody went to see a psychologist, we would think that there's something seriously wrong.
Yeah.
But I think more and more today, we need to realize that we all need each other, in whatever form,
Absolutely.
somehow. And I think we have two people who have been doing this, rightly you said. It's great to have this conversation, and hopefully this opens doors for people to get help in any form, whenever they need something.
That's right. Now, of course, the continuous lockdown has led to disruption in our daily lives, our routines, our livelihood. And while some of us, like Father said, are coping with the situation, some of us have been hit rather harder, right? And we are struggling to keep up with our mental health problems. So, whether you're coping well or not, it's okay to feel overwhelmed by the situation. I think we all do. So, today we're going to explore ways on how we can be kinder to ourselves. And we're very honored to have consultant adult psychiatrist and addiction specialist, Professor Dr. Philip George, and Kenny Lim, the executive director of the Befrienders, to walk us through this journey on Catholics at Home this morning. Good morning, Kenny. Good morning, Dr. Philip. How are you guys today?
Good morning. I'm good, thank you. How are you and Father doing?
We're
Hi, Dr.
good.
Philip. Good morning.
Hi, morning.
Mo-
Morning.
Hi, Kenny.
Morning,
Good morning
Kenny.
to you.
Morning, Father. Morning, Mac. Morning, Dr. Philip.
Yes.
Thank you so much for actually spending your time to speak to us this morning. I think there is no better time to speak about this than now. With the numbers surging, with more people losing their jobs, with more people's lives affected by the pandemic, I think this is just the right time. So thank you once again from the team at Catholics at Home. Now, Father had prepared something that he came across recently about how the landscape of things have changed in terms of mental health. So, Father, would you like to take over it and tell us more about that?
Thanks, Meg. I came across this little graphic. I think that was Kenny would be able to walk us through. This was provided by the Befrienders, and just to look at how the landscape has changed, and they who provide emotional support through phone are seeing an increase in the number of people who are calling. I mean, just looking at it, I mean, they're talking about 120 calls a day this year alone, and we're talking about just 6-7 months into the year. Perhaps Kenny, you could kind of like walk us through this. What is it that what kind of a change are you seeing, compared to pre-pandemic times and now, in terms of what's happening in terms of people calling in to Befrienders?
Yes, Father, as we can see from this graph here, right, there has been an increase in the number of calls that we received. This is the comparison between now and to MCO 1.0 at the beginning of the pandemic. So we are getting more and more calls from people who are affected by the pandemic. For example, calls from people who are struggling with financial issues, people who have lost their job, loss of income, businesses being affected, right? Apart from that, also from people who are struggling because of the lockdown. Yeah, the inability to perhaps go back and visit their family members. They feel very isolated. Yeah, but then on the other the extreme spectrum of it, right? We are also getting calls from people who are having difficulties when they are being together with their family for a long period of time, yeah, because there's no no opportunity or no chance for them to maybe like go out to have some me time. So when you're staying together for a long period of time, there bound to be some like conflicts, fight, disagreement. So we are also getting calls from people who are struggling with issues like that. Apart from that, also working from home, online studying, there are people who are finding it difficult because if you're, for example, working from home, it gets very confusing, right? Like before this, when you go to the office, it's always 8 to 5, 8 to 6. Yeah, there's a fixed time where you go to work. But now working from home is like 24/7, right? So it's a struggle also from people doing online study. We have students who would prefer to go back to the campus because of the situation at home, which is not very conducive. Family members who are not very understanding, the internet connection and all those. So all these issues are very much related to pandemic.
Yeah. No, I mean, I'm just looking at those figures, and I'm just very curious. I don't want to be gender biased, but your figure shows that 2/3 of people who call in are females. I mean, is that something? I mean, that what is there an explanation to that, Kenny? I mean, I'm just wondering.
Right. Yes, this statistics here, basically it has been like that for the past many years. Yeah, it's always been like maybe 2-to-1 females to males callers. I don't really know why is it so, yeah, but perhaps it's for females, it's always easier for them to open up to talk. For males, maybe when we talk about mental health issues, there's always this fear of being judged. That I am a weak person. It's also how the way we are being brought up, yeah. Guys are not supposed to cry, for example. Yeah, you're not supposed to show people that you're weak. You have to be, you have to man up.
You cannot have emotions.
Yes, I sometimes we get calls from guys who tell us things like that. I can't even cry, but I've reached a situation where I cannot take it anymore. Yeah, when they need to cry, they know that they want to cry and they need to cry, but they can't cry. It's because the past 10-20 years we have always been repressing our feelings. I guess that's why, yeah.
I think if I can add, Father, basically, we know that common psychiatric conditions are actually more common in women than in men. And the reasons for that is multifactorial. I mean, one is hormonal. So, even hormones can influence emotions and mood, making mental health issues actually as biological as having hypertension. The other is also the stresses that women go through. They're far more and greater than sometimes men. I mean, going through childbirth, looking after children, taking on different roles, they take on a lot more stresses than men do. Of course, as what Kenny said, they're more willing to talk about their emotions and feelings, perhaps. And most men will close up and clamp up. I mean, the only thing they'll talk to others is, politics or football. But
Yeah, I was about to say that
then
too.
then when they can't cope, sometimes they self-medicate, and that's why we see alarming sort of prevalence rates of alcohol and drug misuse among men compared to women. They may actually be experiencing mental health issues, but don't know how to cope and use the non-conventional ways of dealing with it. But I think reaching out for help is something that women may do more than men do. Sadly, men require the help just as much, but there's a big barrier and obstacle in them actually thinking about going out and looking for that help.
Wow. That's very interesting. But it makes a lot of sense, though. I think women over the years have learned to communicate what they're feeling a little better than men have. So I think that also contributes to the whole problem right now. So when we talk about mental health problems that are being experienced by everyone today, what are they? I mean, are there names to describe these feelings and emotions?
Yeah, I think the first thing is to differentiate mental health from mental illness.
Okay.
So mental health is everyone's issue. I mean, we all go through ups and downs in our lives. I mean, if they announce, okay, guess what, MCO's prolonged, you'll be in lockdown for infinity, well, that's going to definitely impact everyone's mental health. You're going to feel frustrated, anxious, sad, disappointed. All of these are negative mental health emotions. And we, like it or not, we all go through this from time to time. Of course, we need to find whether we have the resilience to cope with it, whether we have, the support systems, and whether we actually can deal with our mental health issues in an appropriate way. And if we can't, then we put ourselves at risk of developing a mental illness, which is an illness compared to, the mental health issue, which is everyone's issue. We go through good days, bad days. But when we don't look after our mental health, we trigger off mental illness, especially if we have a family history, if we have childhood history of, some trauma, if we're carrying some issues with us, if we're actually, maybe overindulging in things that we shouldn't, we are putting ourselves more at risk, with on top of bad news or other things that happen.
Just
Okay.
listening to you, Dr. Philip, I mean, talking about terminologies, and I realize that, sometimes you may be feeling sad, sometimes you're feeling down for various reasons, and sometimes, people you just say, I feel very depressed, is the word that commonly is used. What's the difference? I mean, what are the different stages? I mean, in terms of when you're sad, what are the signs, or when you're feeling down?
Yeah.
Depression, you try and understand, it is a medical condition that requires intervention, I suppose. I mean, severe form of depression. So how do we understand these terms? I mean, if you can help us understand better.
Yeah, sure. So actually what we use is criteria to make a diagnosis. I mean,
Okay.
let's take, for example, migraine. If you've been diagnosed with migraine, it's most probably that you met the criteria for the diagnosis. There's no CT brain or ultrasound or lab test that will, voila, diagnose you with migraine. It is, you have to have at least 6 out of 13 symptoms for a period of time. So, that photophobia, that aura, that, the one-sided headache, it's not relief by paracetamol, the list goes on. But if you meet that criteria, you are having migraine. So similarly with depression, you have to have continuous, prolonged low moods for 2 weeks. Continuous. That's different from sadness. You can't have continuous sadness. So if it is prolonged, continuous, and then it has 4 other symptoms out of a list of 9, you meet the criteria for major depression. So it's not called depression as an illness, it's called major depression. And then we decide whether it's mild, moderate, or severe. So that's how we decide an illness from normal, the colloquial terms of I'm feeling down or feeling depressed or sad.
How will we know, though, that we are depressed? I mean, yes, we're feeling sad. Yes, we haven't felt a sense of joy in our lives. But how can we tell if we're not an expert?
Well, sometimes it's actually our family members that can point it out to us. But also when we start to, not function, because with any psychiatric illness, just like any medical illness, it starts to affect our daily functioning. So if our social occupational functioning is deteriorating, if our academic grades are going down, we're not able to focus, not doing as well as in our papers as we did before, then that's most probably an illness. Of course, it needs to be clinically assessed, and that's done typically by a professional. You can't go on Google and say, "Whoa, I got depression. Let me go, take this and take that." Yeah. So it has to be clinically assessed eventually.
Okay, so Doc, is there specific signs and symptoms that we can look out for, whether it is, in a family member or ourselves? Are there points that we can pick up? Okay, I've been feeling like this, I've been doing that. You said academically, but sometimes we may be blind to our own actions. We may not notice what we're doing, right?
Yeah. So most families actually report, the person is starting to isolate themselves, lock themselves up in the room, maybe video game like too much and, not sleep well, not even eating well, or, starting to lose weight. They're getting more irritable or angry. They're more frustrated. Now, if that's a pattern that happens on a day or two, yeah, that may be stress. But if it's pervasive, it's continuous, it's indicators of, a psychiatric condition, perhaps. So I think the important thing is how far from the norm is the individual, how much is that affecting their daily function, and also what sort of impact it has on the people around them as well.
Okay.
Just to ask Kenny a question, in the sense that, of course, Befrienders, people call in when they need emotional support. If they are experiencing, do you also get calls like people say that, I have somebody in the family like this and I don't know what to do? Do you get calls like that, people asking for advice?
Yeah, we do get calls like that as well. As well as calls from people who say that, my friend is feeling suicidal, what do I do? So in cases like that, our focus is always on the caller first. So of course, this person is affected by what is happening, although it's they are not calling for themselves, right? But because someone close to them is struggling, so they may be affected as well. So what we do is we would focus on the caller, and we would try to befriend the caller, encourage the caller to talk about it and provide emotional support to the caller. Yeah. And then, at the end of the call, we will perhaps tell the person that, if you want to, you can encourage your friend or your family members to get in touch with us for emotional support. Yeah. So the focus is always on our caller first. Yeah.
Okay, I think like the statistics just now showed, right, there has been an increase this year in calls, right? But as a whole, from the time the pandemic hit, how much has it changed in terms of people reaching out for help? Dr. Philip, you said, now every week you practically have conferences to go to talk to people about this. Kenny, you showed us that the calls have increased, is there something that we're not seeing?
Yeah, if I can go first, then maybe Kenny can give his opinion. Actually, this was kind of expected. Famous A&E specialist in America called this the silent pandemic, or the fourth, pandemic. Essentially, if you look at all the different health footprints a pandemic can do, the first is, of course, the COVID cases, and then the mortality, morbidity from COVID, and the outcomes, and then the impact it has on our healthcare system. Because, people with hypertension and diabetes can't get their appointments, can't get their medicines. Those with cancer who need, radiotherapy or chemotherapy are being postponed. So it has an impact on others as well in our community. But the other impact that is often silent is the mental health pandemic. Every disaster has a mental health impact like it or not, it hits us at some stage. It may not immediately because we're in the fight, flight, fright system. We got adrenaline pumping. We're trying to figure out how to survive this. But later on, when we're on our rest, months later, we can actually start to experience the mental health impact of a pandemic. And so, yeah, we're actually seeing this already. I mean, since the beginning in March last year, I've seen a rise in the number of patients making appointments. We've seen rise in a number of patients actually reaching out for help. I think Kenny has elaborated on the number of calls that they're getting. The sad thing is we don't have as much resource as we should. I mean, everyone put mental health in the back burner and thought it was non-essential, non-important, and
Yep.
just put least funding and resources and everything else. And now we're overwhelmed. Just like our ICU, even the mental health specialists are overwhelmed.
Wow. Kenny, anything to add to that?
Yes, I would agree that everyone is overwhelmed, including helplines. For example, at the Befrienders, we have been getting feedback that it's so difficult to call in, it's always engaged. The thing is that because when someone calls us, right, it's not only for maybe 5-10 minutes or even 15 minutes. When you talk about your issues, when you're able to open up to someone, right, it may take up to 45 minutes, an hour. So that's why the line can be quite busy at times. But one thing good about it is that there are many helplines right now. Many have started after the pandemic, I think since March last year. So even Befrienders, there are 9 Befriender centers around Malaysia, and then we have also different new helplines which is available. So I think the problem is that people don't really know about it. Everyone will only talk about Befrienders when you talk about helpline because we are 24 hours, right? So I think as Dr. Philip mentioned, the resources is still lacking, but at the same time, I think people are not that aware of what is available for them as well. So my advice to people out there is that if you are struggling, right, do reach out and, do go online and look for places that you can reach out to. And I will also like to add that at the Befrienders, when you call us, everything is confidential and you can remain anonymous when you talk to us. You don't have to tell us your name or anything that you're not comfortable with. So basically, it's a safe place for anyone to talk about anything at all. Yeah.
No, you're saying about, you're just saying that, people call and the lines are engaged. I mean, just a thought that ran through my mind, maybe to help our listeners too. I mean, what are the peak times? When are people calling in the most? So perhaps to our listeners to call in, not to call in those times if you really need to reach out to Befrienders.
All right, very good question, Father Clarence. I would say we are busy all the time, but especially so evening, late nights. Because late nights or early mornings, after midnight, for example, those are the times when people really struggle. Suicidal thoughts may be very, very times because you want to talk to someone about it. You may reach out to your friends, you may want to reach out to your family members, but then at that hours people are asleep, people are not available, right? So the only place that you can call is maybe the Befrienders, or the other 24-hour helpline is I believe Talian Kasih. So it is quite challenging. And for someone who is struggling, I think it's difficult for them to also control when to call, because sometimes when it hits you, it will just hit you and you just need to call. So again, if you're having difficulty calling in, do not give up. Do not give up. Do know that we do want to hear from you. Try again.
I guess during the day, probably they're caught up with work, and then their family members around you, and you don't want people to hear it. Possibly you're struggling alone, so you want, when they're gone to bed, and probably that's when, I think that's possibly Yeah, Meg, as you were saying, Meg, you wanted to add something.
No, I was going to ask the same question as one of our viewers, actually. So, if you're watching right now and you feel like you've been in a situation like this and you need to ask a question, you are more than welcome to actually drop in your question in the comment section below. And I think we have one by Kath Hazel. Now, she wants to thank us on how to thank us for actually showing how to identify, signs and symptoms of a person going through different emotional states. But she wants to know, right, how can we recognize this situation through communication? So, like, for instance, right, somebody is going through an emotional battle right now or depression, and they are talking to you on the phone, right? So how can we identify, how can we recognize that this person is going through a difficult time?
I think Kenny will be expert at this, but maybe I'll just give my point of view. I think it's important not to jump to conclusions. We can sometimes maybe preempt things that are really not there. I mean, like I mentioned, we all go through periods of stress. So if you call someone, it's not the right time, they've just been informed of some bad news, they may emotionally be a bit different at that moment. It may not actually be something pervasive and prolonged, but you want to provide them the support. And I think having that communication and conversation, very often we don't want to talk about these taboo things, like actually, how are you feeling emotionally? You want to tell me, how things have been for you, how you're coping. Sometimes we're too busy trying to tell them what we are feeling, and we don't give them the chance to talk to us about how they are feeling. And sometimes that's all they need, just a lending ear. But I think Kenny will be able to add more to this. So.
No, I really agree with what Dr. Philip has said, that a lot of times when people reach out to us, we end up talking more about ourselves and we hijack the conversation. And that is not helpful at all. When people open up to us, when they come to us, what they really need is a listening ear. So our role here is to basically listen to them. But to answer that question of how do we recognize someone who may be going through emotional struggle on the phone, or even face-to-face, I think what is very important here is to build trust, is to let the person know that you can tell me anything and it's safe. I will not judge you. So I think before anyone can open up to us, the trust must be there. They must feel comfortable to open up to us. And, once in a while, ask people, how are you doing? You never know, sometimes at the right time, they may just open up to us. It's to build that connection as well.
Now, coming from the both of you, I just want to say, though, I think as human beings, we have this tendency of automatically trying to solve someone else's problem, right? So we say, how are you doing? And that person tells us what's going through their mind. And we're like, oh, you should do this, you should do that, you should do that. How do we change this in us? Because even like for me, right, when somebody comes and tells me, oh, my son, let's take my son, for instance, right? It's like, mommy, I'm feeling this. I automatically want to give him a solution. But what you're saying is sometimes all they need is a listening ear. And I understand that, but how do we change that attitude from giving somebody a solution, which may not be the right solution, to just being there as, emotional support, as that listening ear, as that shoulder to cry on?
I think the first thing is to ask yourself, okay, I'm going to give this advice. Now, if it doesn't work for this person, it falls flat, can you take the responsibility for having given that advice? Are you prepared to say, I'm the one who caused the suffering because he took my advice and didn't work?
Okay.
So I think the first and important thing is, it's empowering rather than, telling. You don't tell people to do things. I mean, not everyone's going to be like you or react like you. So you empower them. What do you think you can do to help yourself?
Right.
Get them to think about the options. What about these other options? Do you think they are appropriate? Do you think there are things that you would consider? So give them a whole bag and then give them a menu basically and ask them what they think would be useful. And then of course you need to also put the caveat, look, I'm not a therapist or I'm not, trained in this. And if what we did discuss, maybe doesn't work, doesn't pull through, you need to maybe see a professional. I can help you in that position because I can maybe give you some numbers, or I can maybe come with you for that first visit, So that's the support that they require, not you coming up with a solution. You don't run people's lives. I mean, it's something that maybe you can do with little kids. You can tell them this is how daddy and mommy live our lives, and you got to follow this too. But when they get older, they're going to say, well, I don't think daddy and mommy were doing the right thing. I'm going to do my own.
Absolutely. Yeah.
So yeah, so when you're talking to friends and other family, I think you need to speak to them in that sort of method. They give them the opportunity to try and solve their own problem.
Absolutely. Okay, that's
But
brilliant advice.
just listening, listening to you, to both to Philip and Kenny, what goes through my mind is that, how do we spot maybe red flags, for example? For the tendency, especially among young people, when you are talking to someone, you say, oh, I feel like going and jumping off a building, and then you kind of brush it aside. You just say, yeah, you're just joking, and. But at which point, when we are talking to someone, do we kind of have to notice some of these things? Are there some red flags that we need to take notice of when people are talking to us?
Kenny, you want to
Dr. Philip?
start?
Or anybody? Yeah.
Okay.
Any one of you. There was kind of a silence suddenly. The reason I ask, because we also reading that suicide rates are higher during this time.
Yeah. It has
So
gone up.
people may have reached out, may have said something to someone, and maybe we didn't catch it. And they felt that no one was listening to them. So maybe are there some red flags that we should be watchful of, be sensitive towards?
Yeah, I think whenever someone says something like that, right, as what Father Clarence mentioned, even jokingly, we should not take it lightly. We don't want to just brush it aside. So what you can do is basically just pick on that and then ask, what do you really mean about that? Yeah, and then try to get into a conversation with them. Because sometimes, when it comes to suicide especially, it's such a taboo subject. There's so much stigma that's attached to it, right? It's very difficult for someone to actually say it out. Even though research is telling us that, people who have suicidal ideation, right, there's always an urge or a need for them to basically send the message across, to express it. But it's not easy because, if I say I'm suicidal, how would people react? Yeah, people will just simply say, don't think about it, you should cheer up, things will improve. So there's always this fear of being judged when you express it. So maybe sometimes people will just say it as a joke and then test, will this person take me seriously? Will he or she say something about it, right? So I think whenever you hear something like that, or when you see something like that on social media, especially right now, right? Because many young people are using social media to express how they're feeling. So if you see something like that, I think it's very important for us to intervene, to reach out to them and ask, hey, what's happening? Do you want to talk about it, right? So that is true, their verbal expression, the things that they post. But of course, when it comes to suicidal warning signs, there are also many things to look out for. For example, making final arrangement, like, they would call you and ask for forgiveness, to say goodbyes, without mentioning about being suicidal, change of behavior, extreme feelings of hopelessness and helplessness, that withdrawing themselves from you, from others, change in their eating habits, sleeping patterns, and all those. So there are signs to look out for. And like I said earlier, right, for someone who is feeling suicidal, there's always a need for them to express it. But, sad to say, it's difficult for them, and they do not know where and who to express it.
Yeah, I think actually Kenny is absolutely right. The important thing is not to brush it off. You need to take every communication that's related to suicide seriously and go that extra mile. Just, continue to inquire, what do you really mean by that? And, are you actually thinking or considering suicide, many people are actually asking for help when they bring this up. And if you don't take the cue and you say, don't talk rubbish, no, just forget about it, you haven't taken the cue. You actually haven't, they're reaching out for help, they're putting their hand out, and you're brushing it away. In fact, studies have shown that 60 to 70% of people who do commit suicide actually have reached out to either a doctor or a close friend in the week preceding the event. And the thing that happened was it was not seriously considered. Even the doctor may have brushed it off. So I think we should take ourselves away from being so uncomfortable talking about emotional things and start to actually engage. I mean, we don't have the answers. Again, if you're not mentally trained, you're not going to be the one who saves that person. You're going to be the one who says, okay, actually there is hope, I think, and let's go see someone. Let me support you in actually seeing someone to help with this.
So, what exactly drives a person to consider taking their lives? I mean, to what extent would that problem be so bad? I mean, could it be anxiety? Could it be depression? I mean, young people these days are expressing everything on social media, and sometimes we may not realize it either. So there's so many questions there. Maybe you guys want to answer them.
Yeah, I think most research actually suggests that 60% of suicide is related to major depression.
Okay.
So that's
But
an
what is
illness.
it due to, Doc? I mean, is it because of family problems? Is it because of studies? Is it because of work? Especially during this whole pandemic.
Yeah, so I mean, essentially, if you look at the causes, if there's an illness, then you need to treat the illness. Of
Correct.
course, the illness is multifactorial. That means, it could be genes, it could be childhood, issues, it could be neurochemicals in the brain, it could be stress. But really going back into the past and identifying what the cause is not going to be, of much benefit as compared to let's treat this treatable illness. 90% of people actually get fully well. And suicide is a symptom, right? Of course, during a pandemic and even during our last economic recession, we've seen an increase in suicides, and that's typical of developing countries like Malaysia. A lot of them are actually financially driven, not mental illness driven. They don't develop depression and then go and commit suicide. It's their hardships. They can't cope. They can't put food on the table. They got alongs on their back. They got, so that's a social issue. We can't go and do therapy for a social issue. They may need support from, the NGOs, the government, and other. But if that's not available or they don't know where to look for it, then it puts them in a, tight spot. Hopelessness is the biggest trigger for suicide. So if you've lost all hope, nobody's there to give you any hope. Even your best friend says, just forget about it. Then you will end up, thinking that there's nothing else like you have left in your repertoire.
Oh, that's really said. I think a lot of people have felt that way, isn't it? Financial problems have, kind of pushed everyone to that edge right now. And I think that explains the increase in suicide cases over the past year or so. Kenny, anything to add to that?
Yeah, I would like to add that, when it comes to suicide, it's about wanting to end the unbearable emotional pain that they are going through. Yeah, it's not
Yeah.
about ending my life. It's about the pain that I am struggling with, and it's getting to the point where I cannot take it anymore. Yeah, and as what Dr. Philip mentioned, yeah, the hopelessness in them. Can you imagine living without any hope? How difficult it is, yeah, not being able to see the light at the end of the tunnel, or thinking, believing that there won't be any light at the end. So if I have to live in total darkness for the rest of my life, how can that be? I mean, I don't think I want to do that. Yeah. So that's why hopelessness and helplessness as well. Helplessness in the sense that I don't think no one can help me. And I feel like I cannot even help myself. So it's really about the pain, the struggle, the hardship that they are experiencing. Yeah.
So, besides taking their own lives or suicide, are there other methods of escapism? I mean, addiction, probably. I don't know. What else are there?
Yeah, so as I mentioned, some people may use inappropriate, maladaptive ways of coping with stress. And that can be quite sad because then they develop two different problems. They still have their stress, it's not gone because, suddenly they decide to up their alcohol amount. And then now they have an alcohol problem. They're waking up hangover, can't focus, can't concentrate, and it's affecting their work. And so it's a vicious cycle. I mean, essentially, the thing is, we have neglected really bringing about the mental health component in our education, in parenting, in our schools, in teaching everyone from young how to deal with day-to-day stress. People who are coping right now is because perhaps they actually have more resilience. And religion, of course, plays an important role. So if they're praying more often and they take those measures, but also then take care of other mental health skills, and they put that as part of their lifestyle, they may actually cope and have better immune systems, in fact, to even ward off the infection. So, I think it's time to come out of this whole thing and say mental health is just as important as brush your teeth in the morning. I mean, you're brushing your teeth because, it's not because you got tooth decay, it's to prevent it. And that's exactly what mental health investment is all about. How much time do you spend in a day for your own mental health? And how do you build that up so that you can cope with these sort of disasters that happen in our lives,
That's a brilliant point, Doc. So, how can we cope in this situation? We already know the pandemic has hit us hard. As much as we want to say, it hit us health wise, but mental health is, like you said, it's a silent disease and it has left its effects on our mental health. So, how can we cope or manage our mental health in this pandemic?
Yeah, just to add to what Meg has said, like you said, early morning, so what's the mantra that we need in the morning when we wake up, to say, this will be a good day. Now, I just add on to what Meg said, because sometimes when you're down, there's an amount of paralysis. You don't feel like you want to do anything, So how do you make it a good day? How do you help yourself? Are there some practical tips, Doc?
Well, I think a good day starts with a good night. So that's the first step. Make sure you're actually having adequate sleep. 6 to 8 hours is what we recommend adults. I mean, teenagers need more. Sometimes they fail to recognize that their brain is still developing. It actually gets fully developed at the age of 21, and sleep helps the development. So if they're on the video games and, staying up all night in the social media, they're ruining their mental health. So 6 to 8 hours for adults, maybe about 10 hours for teenagers. And as we age, the hours actually start to reduce. So the quality of sleep actually determines our following day. Sometimes what I typically advise my patients is use a positive, sort of thought prior to sleep, so that actually sort of, colors your whole dream and your sleep quality, so that the next day you're waking up feeling positive about the day. So it starts with your sleep, because that's actually recuperation from the day. And then in the morning, you need to start focusing on what you will be able to achieve and do. And I think the first important step is, identify how you are feeling in the morning and what you feel about yourself. I mean, looking in the mirror in the morning and saying, I'm a good person, I have good things ahead of me, and I want to make things very good today, will actually then determine how the rest of the day pans out sometimes.
So what we see in movies actually work. Self-affirmation works.
Definitely. I mean, what you feel is actually going to determine the positive mind attracts positivity.
Absolutely.
If you are feeling negative and have all these negative thoughts and feel there's nothing to look forward to, you're only going to attract negativity to yourself. The law of attraction actually states that if you look back at the periods when you'd had a tough time and you were thinking negative, you notice that there were things piling up. It was not like just one thing, it was like 2-3 things, And
Yep.
if you actually changed your mind to actually focus on the positive, you might have actually attracted more positive things in your life.
Wow. Okay. So that explains why every time I get up and go, oh my goodness, today's going to be a really bad day, then it happens. Law of attraction things. I need to get started on that self-affirmation thing. Now, I want to know though, there is one question. Okay. So how do we cope if we have fallen into an addiction? Then how do we manage the situation then?
Yeah. I mean, the first important step is awareness. Most people who get into an addiction are in denial. That's what we call the pre-contemplators. They think that the addiction is, well, no big deal. I can afford it. It's not causing any harm. I'm still getting into work, blah, 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 blah. What actually it is destroying them. And, if without knowing soon, the addiction takes over their life. So it's important to have the awareness and then make some sort of mental count. How much am I using? What am I using actually? And how often do I do this? Is it actually, becoming the priority in my life? I'm giving up the other things that are important because this addiction is more important to me. I give up my sports because I want to come back and drink early, or, I sleep late because I want to drink more. So are we actually being ruled by our consumption and addiction? And if we are, then we need to look at, okay, can I actually work on this on my own, or do I need help? Usually in the early stages, most people can actually look at a period of abstinence and go through detox on their own with support from their family, and they might get through it. But once it's far gone, they need to look for medical help. Because detox from some substances can actually be life-threatening.
Yeah, that's true.
So they may actually have to be warded to help with that process, and then therapy and treatment and all comes in as well.
Now, Doc, there's not just a certain type of addiction, right? I mean, there's addiction to substances, there's addiction to alcohol, but in this current age, I think a lot of people don't realize, but being addicted to social media is also a type of addiction. Being addicted to watching Netflix like till 5 o'clock in the morning, is also somewhat of an addiction, because you're trying to escape the reality of what's happening around you, isn't it? So there are many different types of addictions.
Yeah. So, I mean, we divide them into behavioral addictions and substance addiction. So behavioral are basically, your over engagement in social media, in video games, in, all the other things that you mentioned as well. So they're just as addictive as well. The only difference is you may not have, withdrawal symptoms. I mean, you can have psychological withdrawals. You're not going to go into physical withdrawals if you abstain. I think the important thing is to, again, sort of make a measure of how much you're engaged in this. We actually have guidelines. 2 hours of social media, video games a day is what we recommend, not more than that. I mean, if you're binge watching, that's very different from, every day watching. So if you're watching a series and you do it for a day or two, well, maybe that's acceptable. But if it's going to be a continuous thing, then that might actually be an addiction as well. The most important rule is it impacting on your day-to-day life, your relationships, your work, and other aspects of your life that you're neglecting?
I'm just gonna jump in here. I mean, since Meg always introduced me as the resident priest, so let me be the priest here.
Yes.
Let me be the priest here. Either Kenny or Dr. Philip, how important is a spiritual life in the context of mental well-being? I mean, yeah, I think that's the question that I've been wanting to ask. Dr. Philip, you alluded to it earlier, but you didn't expand too much. A relationship with God, a sense of meaning at this time. How important is that?
Okay, I think Kenny is a professional in this area. No, but I'll just give my few cents worth of opinion. I think it's as essential as everything else as well. I mean, uh, we have things in our life that we have no control over. The pandemic is not in our control. The lockdown is not in our control. So we leave it up to somebody or something. And I think if we have a higher being like God, it actually helps us feel that we're supported, that these things can be left to the Almighty's hands. And we can go about doing the other things that help us manage the, other things in our life as well. If we're lost in this, space of, I don't know what's happening, I have no control and no nothings, we just get so anxious and worried, and we're making ourselves, spiral into a frenzy. And because God is there, He helps us through these uncertainties. I mean, that's what I think, Jesus and God is all about, basically. And I think the moment we think that we need to pay less attention and less focus, that's when we become victims of our own, sort of spiral into, worse mental health and even morbidity as well. Kenny, you wanted to say?
Yeah, when it comes to suicide prevention, yeah, religion is a protective factor. So it is, it helps protect people from, being suicidal or even to act out on that suicide act. Yeah. But again, we have to be careful how we use it, yeah. Because we have gotten calls from people who say that things like, I have prayed consistently. I go to church every Sunday. I prayed 5 times a day, but yet I'm feeling this way. Yeah. And then you have people who would tell them that, if you're feeling depressed, you just need to go and pray, then you will feel better. And telling them that they don't have to go and seek professional help, for example. Yeah. So it doesn't work that way. Yeah. Although it's a protective factor, but then if you are really depressed, for example, you need a professional help. You need to seek treatment. Yeah. And those of you who are supporting people who are struggling, be careful with how you use that, religion. Yeah. Like, for example, you may say things like, do you feel like you want to go to pray? I can accompany you. We can do it together. Yeah. Rather than telling them that, you should just pray and you'll get better. Yep. So it's how you use it. Yeah.
There's a very fine line that you thread on. Okay,
Yeah.
get it. On that note, though, if someone is feeling, is struggling and in that situation, where can they go for help?
Yeah, so I think Kenny will maybe inform us of the helplines and Befrienders. The physical places that I would be able to maybe suggest are actually all public hospitals and university hospitals have psychiatric units, and they have psychiatrists. Some units have psychologists as well. And they typically see patients at very, very low rates. It's only 5 ringgit per appointment to see a specialist and even get medication and therapy as well. But you need to have a referral letter from a clinic kesihatan, and it may, be by appointment, but typically, you should be able to get an appointment within a few weeks. There are private centers. The only problem with the private centers is, of course, the cost, and because in Malaysia, surprisingly, it is not covered by insurance, whereas the same insurance companies that cover us in Malaysia are covering for those patients in Australia or in Singapore or some other countries. They're prejudiced against our mentally unwell Malaysian patients. I have no idea why. We've been fighting with them for years. But that's the other option. Of course, the cost can be varied. Right now, actually, places like Relate Malaysia, Souls Health, Malaysian Mental Health Association, they are providing subsidized therapy. And so those are places that can actually be explored as well. The other is sorry, I was going to say something. Well, a lot of them are actually online, so sometimes you don't need to actually go face to face. And also the Archdiocese Mental Health Ministry, led by Father Philip, they also have services available, mostly online now, but you can make a call and then get an appointment there as well. So there's a few places. I think, Kenny, you want to add on to that?
Yeah, I think apart from going to the public hospital or klinik kesihatan, you can also explore Pusat Mentari, which is a community mental health center by the Ministry of Health. Yeah, I'm not sure how many centers are there in Malaysia, but there
I think
is
there's
at least
26.
one.
Yeah.
26. Yeah. Okay.
Yeah.
Thanks,
All right.
Doctor.
No
But
problem.
there's at least one in each state, and in
Yeah.
KL, Selangor, there are 4 centers. So these are centers where, before the pandemic, you can actually walk in and they will run tests, self-screening tests, and then advise you what to do. But I'm not sure during pandemic now whether you can still walk in. Yeah, so perhaps you can call and check. That is Pusat Mentari. Apart from that, I think the thought of going to seek professional help can be quite scary at times. Yeah. So if you are not ready for it, maybe you can try to reach out to a helpline first and talk to a stranger, because sometimes, people feel more comfortable talking to a stranger. Yeah. And as you can see on your screen, there are so many helplines that's available right now in Malaysia. And that is really something which is very, very positive. Yeah. So I think when it comes to helpline, also you may have fear calling, but just give it a call. Don't worry so much about it. Because, like at the Befrienders, for example, you are in charge of the call. You call and you try to say something and see how you feel. If you feel uncomfortable at any time, you can put down the phone. Yeah, but of course, we hope you won't. But at any point of time, you feel like you're not comfortable, you have the option of doing it. Yeah, and some of our callers need a few calls before they are able to open up, and that's okay. Yeah.
I think, Kenny, it's also confidential, right? I mean, you can
It is.
you can actually not give your name as well, right?
Yes.
Just be anonymous. Okay.
Yeah, I know.
All right.
And the numbers are not traceable, I guess. I suppose,
Yes.
from what
We
I
don't
understand.
do-
Yeah.
We don't do number tracking. Yeah.
And very quickly, and Kenny, if I understand correctly, that people who call in, it's a free call, right, to Befrienders. Is that correct?
Okay.
Is that a toll free number? Like,
It is
if I
not a
Okay.
It is not a toll-free number,
Okay.
but if you are subscribed to one of the 8 main telcos, you can call us for free.
For free.
Okay.
Maxis, DG, Celcom, U Mobile, and the 8 main telcos.
Okay.
I think they launched that last year when the cases were going up, isn't it, of people who needed help?
It's 2 years ago, I think.
2 years ago. Okay.
2019, yeah. Even then also, when they launched it, right, the number of calls increased.
Oh, okay.
And it's really helpful because we do get calls from people who say things like, I don't have enough credit. What do I do?
Yeah, that's right.
So,
Yeah.
I think that is the point I was saying, that people, I mean, even if you have low credit, you can still call like Befrienders, and it's a free call basically to them.
Yeah.
I know, Dr. Philip, we need to let you go. I know you're in big demand these days. For many people. I just have one question, if you may allow me to just bring it up.
Sure.
This word PTSD, is being associated now with the pandemic. It's a word that we often hear about people coming back from war. It's in the literature. Now it is being associated with this.
Yeah.
Do you think that, now that we have highlighted the importance of mental well-being, do you think, that in Malaysia, that we would come to that, after this pandemic, there's a need to have trained counselors in schools, proper counselors in schools, proper counselors in workplaces, to help people? Would that something that we really should, lobby for?
Oh, no, you're right. You're absolutely right, Father. In fact, the National Coalition of Mental Wellbeing, which was just founded last year by Rotary Malaysia is actually focusing on this. And I'm actually helping to chair the Youth Mental Health Initiative. And we're looking at one, training the counselors, because sadly, although some schools have counselors, they're not actually very trained, very well trained in mental health. And sometimes they're not as effective and efficient in dealing with mental health of young people. The other is actually we're looking at peer group, sort of clubs, or what we term as Mind Matters clubs, that young people can actually take charge of their own mental health, and also encouraging others and promoting others for mental health as well. So when you have a club in the school, you got a debate club, you got a chess club. If you have a club that's focused on mental health, it helps bring from the peers to the others mental health skills. It's not about mental illness, but it's about mental health skills. And so we encourage them, because we can't push it through the curriculum yet. When it does, then maybe things will change. But we've also got a committee working on workplace as well. So yes, Father, it's actually something that we are all engaged and trying to work on. Yeah.
Yeah, I think that's a very important thing. I think this is one of the realizations that that at least for me, in workplaces, we expect people to perform optimally, but sometimes we don't take care of their mental well-being. The stress at home, some people who don't perform, maybe it's because of stress at home, and they have no one to talk to. If there's a place in the work in your office or in your workplace that you could go to, and you know that you will not be penalized. It's a safe and sacred space that you can talk to, and I think that helps. And maybe that's something that we need to talk about. Yeah, maybe I don't know, Meg, do we need to let Dr. Philip go to his other engagement?
Yes, we do need to let Dr. Philip go to his other engagement. But just before that, Dr. Philip, before you leave us,
Yes.
what's the most important thing that you want all of us to remember when dealing with a mental health problem?
Yeah, so I think it's good to do an audit. Just go through what are the things that you are doing currently to help your mental health. I mean, you may not be, everyone is to some extent impacted, I'm sure, by this pandemic and the lockdowns, but it may not be extreme. But it's still important to identify what and how you are currently coping, and what you can do more to actually help yourself through this process. Do that audit regularly, do it weekly, and then learn about the different skills in building mental health. We actually have tons of apps and online tools that are verified and very effective. One of the ones that I can maybe share with everyone here is something called Sanvello, Sanvello. It's a free app. It actually teaches you meditation, mindfulness, breathing. It checks on you regularly. And I engage in it myself personally. The other app that I think is very useful is Gratitude Journal, because we focus too much on the negatives. It's time that we actually change our perspective. And I recommend this every night before going to sleep. List out 3 positive things in the day. Gratitude Journal is an app which is free, and it prompts you and it helps you to focus on building your mental health skills as well.
That's
Oh, yeah,
brilliant.
that's thank you so much. Yeah, I think that's something that we all can download. Sunvelo and Gratitude Journal.
Yeah.
Yeah.
Dr. Philip, we wish we could have you for much longer, but we understand that you have to leave us. Thank you so much for
All right.
joining us on Catholics at Home this morning.
Thank
We
you for
wish
having me. Thank you,
wish
Father.
you a great day ahead.
Thanks, Dr. Philip. But we will
Nice
have
to work with you,
Kenny with us for a while. Yeah.
Yes,
Yeah, we will
okay.
continue.
Okay,
Take care, Dr. Philip.
goodbye. God
Bye-bye.
bless. Bye. Bye.
Yeah.
All right.
Yeah.
So we're still on the topic of being kind to our minds and telling ourselves that it's okay not to feel okay. I think Kenny and Dr. Philip have both given us really good advice throughout the show. I think, Kenny, there was a question much earlier on about the calls that come in, right? Is there no face-to-face dialogue? What percentage of their calls are genuine and not prank calls? How can you identify if it's a genuine call or a prank call?
Okay. What happens is that we do have a face-to-face appointment sessions for our callers, yeah. But because of the pandemic, we have actually stopped it for the time being. But to answer that question, right, how do we know if it is a prank call? Of course, our volunteers are being trained to recognize prank calls. But we always focus on their feelings, like, we get them to talk about their feelings, their pain, and see if they're able to open up. Yeah. Even if someone is unable to open up, but there must be a reason why they call us, right? Maybe they're struggling with something and they call us, they're not ready to talk yet. They just want to test our service, see how our, volunteers respond to them, for example. Yeah. So we don't actually dismiss them right away that they are prank calls and put down the phone. But we would try our best to engage them in conversation, and hopefully they'll be able to open up about their issues. Yeah. But sometimes we do get silent calls, for example. What we believe is that maybe they're just not ready. Yeah.
Yeah, I was going to get to that. Could
yeah.
it be that they called, but the moment the call got picked up, they just froze, because they're too afraid to speak about it? Father, what were you saying?
No, I was just going to ask Kenny, maybe, some practical tips. I mean, I know it's too short a time to do a role play, and this is not counseling supervision in any form. But, if someone comes to you, I mean, of course, not everyone is ready to call. Maybe someone reaches out to a friend. What are the things that, that one should do? How do you respond in a concrete situation? If some examples, Kenny, so our listeners also, if somebody reaches out to them and they have something to, how to have a conversation, at least an initial conversation with someone who may be trying to ask for help.
Right. I think
Man,
to begin with, sorry.
Should we ask Meg to role play? Should you ask Meg to role play with you?
No, Father.
Maybe I'll just share with you all what are the things that you can do and what are the things that you should not do.
Yeah.
I think to begin with, the very important thing is empathy. That, the ability to put yourself in the other person's shoes and try to imagine what that person is going through. Yeah, and that is one quality that we look for in all our volunteers, empathy, and the ability to accept that person no matter what kind of issue that person is going through. Because sometimes your friend may come to you and talk to you about something that you don't agree with. So how are you able to support someone if you don't agree with whatever that person is saying, right? So acceptance here doesn't mean that you have to agree with whatever that person is saying, but to just acknowledge that this person is struggling because of this issue. Yeah. Don't be judgmental, saying things like, you shouldn't be angry with your mom because she's your mom. Yeah. We all know that, we are not supposed to feel that way, but the reality is that there are times when we feel angry or we feel disappointed, at our parents. Yeah. And, in situation like this, I think it's important to be able to express it. Yeah. So do not judge them. What's also very important is validate their feelings. Yeah. I think a lot of times when we are experiencing difficult emotions, we feel very much uncomfortable about it. We may feel like, am I wrong to be feeling this way? Yeah. But when it comes to feelings, I personally feel that there's no right or wrong. Yeah. It's just that you are going through that phase. And when someone comes to you, I think it's helpful if you can validate their feelings. Saying things like, it sounds to me you're feeling angry because your mom doesn't seem to understand you. So when we reflect feelings, we are showing that person that I can empathize with you. I can understand what you are feeling, yeah, and I am listening to you, yeah. But saying things like I understand is not very helpful, yeah, because the feedback that I have gotten, yeah, from talking to friends is that you can never understand what I'm going through, yeah, because you're not me, yeah. So instead of saying I understand, you use reflection of feelings, and that just shows that I am with you, yeah. And basically, allow them to talk about their pain. I think when it comes to pain, yeah, we are all not comfortable. We don't want to go there. Yeah, that's why we say things like, "Oh, cheer up. Let's go and get a drink and forget about the problems." Yeah, because we ourselves are not comfortable in listening to pain. But what really helps is that to allow people to talk about their pain, and that's what we do at the Befrienders. We encourage them to talk about their pain. And I believe that, when we talk about relief, recovery, it always starts with, addressing your pain. Yeah. So, basically just listen, be there with them. I think that helps. Yeah. You basically don't have to do a lot. Yeah.
I guess
I'm just going
that's
to
why
add.
you
I'm just
need to
going to
reach out
add
to a
to.
professional.
Yeah,
Yeah,
sorry.
go ahead, Father.
No, I'm just going to add to what Kenny was saying, and then we come to Meg's question. Just listening to you, I think what doesn't help also sometimes is I think what helps is to suspend our own spiritual and moral judgments. Not to take a higher, because I think sometimes when we have our own spiritual judgment, and then like the example that you were saying just now, and I'm very angry with my mother, and then you start quoting the Bible to say, oh, the Bible says you must honor your father and your mother. That doesn't really help, because
Yeah,
that adds to
adds
the
fuel
guilt.
to the fire. Yeah.
Yeah, it just probably adds to the sense of guilt that what you are doing is wrong, and you do not know how to handle it. So I think sometimes, when listening to people, we just need to suspend all these things, our own spiritual uh, experience of God, our own where we are in terms of our spiritual journey, and to allow people to say what they think. And sometimes it may not be in tandem with what you believe. Sometimes I would think, I think that's then you feel the need to say something. You feel that, or but I think at a time like this, sometimes I really, what Kenny said, is just to be able to listen to someone, and to say, yes, this is what somebody is feeling, and I need to be there, to put aside whether I believe, I don't believe it, or whether it is, it's against my spiritual principle or moral principle, but to accompany someone in their pain and their struggle. And I think the Holy Father regularly talks about accompaniment. Yeah. Yeah, I think this is what I think one of the I wanted to add, because the moment you start quoting your spiritual traditions, and then it makes the person feel worse. I mean, correct me if I'm wrong, Kenny. In any,
Yeah.
you feel a kind of a guilt, and that doesn't help anyone in the situation.
It just adds to the burden of everything that you're feeling at
Yeah,
that moment, isn't it?
exactly. And I think the tendency sometimes, for it's well intended. Sometimes people who are, it's well intended, but sometimes we don't realize that causes a little more harm than help
Help.
in situations like this.
Yeah.
And I've heard that so many times from people saying, well-intentioned good Christians who tell them, like you said earlier, pray more, or you said, do this more. But sometimes the human emotions need to be attended to in a different way.
Different way. Yep,
Yeah,
absolutely.
so true. I mean, it's not what you want; it's what they need. Yeah,
Yeah.
person who's coming to you for support. Yeah.
And I think you're very right in terms of saying that we are uncomfortable with listening to someone else's pain. So that's why we either try and find a solution, or tell them to do this or do that, or the Bible says this or that, because we ourselves are finding it difficult to
Yeah.
listen to you because we're uncomfortable. And that's why
Yeah.
it's important to actually reach out to someone who is a professional, whether it's the Befrienders or any of the lines that we've actually projected earlier, because these are the people who are trained to listen to you. I mean, sometimes all we do is just listen and say, okay, we understand that you have a problem with your mother, but that person might be like, okay, so you understand, and then what? So there's no way of actually being able to help unless you're properly trained for it. Would you
Yeah.
agree with that?
I do agree to a certain extent, but I also believe that every one of us has a role to play, even though you are not trained, yeah, in providing support. But understanding what are the things that you can do, because
Yeah.
I think sometimes the presence, just being there, is so important. Yeah.
Okay.
Sometimes you don't even need to say anything, but be there with
Be
them.
that.
But of course, what's the next step? Yeah, encourage them to call a helpline, to go and see a professional. That's also very important. I think walking with them through the journey is important. Yeah.
Okay, if someone okay, for instance, like someone tells me their problem and I don't know what to do, but I'm trying to help them in this journey, can I call the helpline and say, hey, you know what, I have a friend and this friend is going through this and I don't know how to help the person, what can I do? Would that be a better alternative?
Well, what I hear you say is that you're feeling very helpless, right, in situation like that.
Yeah,
So
because you don't know what to do.
yes, and it's also because you care so much for this person and you worry for this person. Yeah, I think in situation like that, you can. What you can do is that you can call a helpline yourself. You can also go online and check what are the resources, what are the things that you can do, you are not supposed to do. But I think also to let that person know that I care for you. I really, want you to know that I will be with you in this journey, but I am at the loss. I am also feeling overwhelmed. But let's do this together. Let's find alternatives. Yeah. Yeah. You don't want to just like, give them the wrong idea that I'm rejecting you or what. Yeah.
Yeah, correct. Yeah. Okay. So there is a question on our comment section, which is asking about the suicide rate among mental health professionals. Would you know of that?
I don't know the details, but I know that the suicide rate amongst mental health professional is high. Yeah, it's high.
So why does that happen though? Because this person wants to know that, being a mental health professional, you're normally equipped with all the tools and, all the ways to manage this. So how does this happen?
I think there are many reasons to it. One could be the stigma. For example, I am a mental health professional. I am a counselor. So I should be strong enough to
Yeah.
manage all my problems, right? So maybe it's more difficult for them to reach out. Yeah. Another thing is also the access to the means. Yeah. For example, if you're a psychiatrist, it's so much more easier for you to get pills to do it, right?
Yeah.
Yeah. So I also like to say that I think the things that we discuss here today is very important, very useful, but may also trigger some of our listeners out there. So if any one of you feel affected by what our discussion, right, do reach out for help. Yeah.
Absolutely.
Yeah, I think that's an important point. I think there's the whole purpose of this conversation this morning with Kenny and Dr. Philip is to bring about an awareness, and I think the awareness is that you don't have, if you are struggling, you don't have to do it alone, and don't do it alone. I think that's the key message that we want to get out to people, because I think a lot of times we talk about suicide, they come to a point when they don't see any other option. They don't see anybody supporting them, and I think the messaging that we want to send out is that you, like the title says, it's okay to not feel okay at this time, and we all are. Let's face it, we all are. Whether it's healthcare professionals, whether it's priests, whether it's any ordinary person, our lives have been disrupted, and there's some level of anxiety in all of us, whether you're a person of faith or no faith. I believe that, what you see in the papers in the morning, or the daily reports that you read, it affects us whether we know it or not.
There's
But
just too much negativity around us,
yeah,
isn't it?
yeah, and I think that's the point. When it says you don't have to do it alone,
Yeah.
just reach out to someone, and I think that's the key thing and I think we want to tell people this morning. There's so many places, organizations, people, or even if you can't access to a number, reach out to a friend, a close friend, to talk about. Always told that talk about it, and it feels alive when you are to talk about it to someone, rather than building a bubble within ourselves, and it comes to a point when you're not able to manage it.
Yeah. I think the underlying reason for having this show today is to tell you that it's okay to reach out. It's okay to not feel okay, because the awareness is very low. Every time we want to reach out, we feel like, oh, maybe I shouldn't. What would people think of me? What would they say about me? Does that mean I'm not doing well? Am I sick? Do I need help and stuff like that? But we're all in this same situation. Like Father said, the pandemic has disrupted our lives, whether it is through your jobs or the fact that you're isolated at home with your family and you have nowhere to go, or you're isolated alone. There's so many different reasons why we're feeling this way. And I think Kenny started the whole conversation just now with it, isn't it? I mean, working from home is also another reason. A lot of people have been complaining of anxiety attacks due to the work from home situation, right? And I think a lot of people don't understand why it's happening, because I think when we're at home, there's just way too many things that are happening at the same time. Not just work, but yeah, everything else. So there are so many things that are bugging us these days due to the pandemic, and it's okay if you're not feeling okay, and it's okay if you feel like you can't cope. Reach out for help. So I think we've come to the end of the show already. Kenny and Dr. Philip, you guys have been amazing today. Before we let you go, Kenny, anything else you'd like to add for all our viewers this morning?
I would like to maybe mention the title today, Be Kind to Your Mind. It is so apt at this point of time, I think, because most of the time we are thought or we are expected to be kind to others, but we forgot about ourselves. We end up neglecting ourselves, yeah? So I think it's important to spend time to be kind to yourself and ask yourself, how have you been treating yourself? Yeah.
Awesome. Father, anything that you'd like to add?
No, I think I've just said what I wanted to say earlier, Meg, and to our listeners, and I think the whole purpose of this conversation is that, reach out, if you need help, do not hesitate, I mean, if the figures show that men are reaching out less, and I'm calling out to all the men out there who are struggling, do not hesitate. Do not hesitate to reach out to get some assistance, and there are so many places that they can go to. A phone call, like I said, Befrienders. I think we have the number that is scrolling in our screen here for emotional support that you need. It's anonymous. There are many other places that you can call to. Our Archdiocese Mental Health Ministry that you could call into, and let's journey together at this time. Let's support one another. Let's not judge one another. Be available to one another. Yeah, I think that's what I think this whole conversation this morning is about.
Absolutely. Now, of course, we want to thank you so much for joining us this morning on Catholics at Home. Remember, it is important for you to be kind to your mind. It's okay to not feel okay. We're all in this together. And to end the show, as always, Father, would you like to say a prayer?
Sure. In the name of the Father, Son, and of the Holy Spirit. Amen. Dear Lord, we thank you for this morning. We thank you for this conversation with our guests, with Dr. Philip, with Kenny, and the work that they do together with many other people for mental well-being during this difficult time. We pray for all health professionals who are providing mental support to the many people who are struggling with these challenges. We ask you to use them. We pray for those who are struggling with mental health issues, that you'll be close to them at this time. We pray for ourselves too, that in our own little way, we may be able to accompany one another, especially when our friends, family members reach out to us. Maybe walk with them, maybe able to hold their hand, and to be able to walk together to come out of this pandemic, to be recognized that you are there with us. We make this prayer in Jesus' name. Amen.
Amen. So there you go. We've come to the end of the show already this morning on Catholics at Home. Thank you so much for joining us. Don't forget to like and share this so that many more people would be aware of what we spoke about today. And we may just help someone out there. Also, if you're thinking of what you can do to help someone or a friend or a family member who are going through really tough times, we have another slide that's coming up really soon on what you can possibly do to help them. But for now, we want to say thank you for joining us on Catholics at Home. We'll see you next week, same time, same place, right here on Facebook.